Good morning. My name is Allison Blajda.
And I'm Kelsey Brykman.
We are both students at the Harvard Chan School of Public Health, and we've had the pleasure of working with Dr. Yamini Saravanan from Cambridge Health Alliance on a project involving patients in the co-design of their care. I want to start by telling you about a man named Jose. Jose is 42 years old, and he's originally from El Salvador. He's a recovering alcoholic, has abdominal pain, and is a frequent emergency department user. Recently, Jose's doctor diagnosed him with a hernia. This can easily be surgically repaired, so his doctor referred him to a surgeon. But Jose became nervous when he heard this word, surgery. He has a friend who spent 6 weeks recovering from surgery. He thinks about missing work and bills piling up, bills for food, rent, and child support. He could even be fired for taking too much time off. So, Jose no-shows to his appointment with the surgeon. He goes to the ED the next few times he has pain, and he skips several appointments with his PCP. A few weeks down the line, Jose might get a patient survey. How do you think he should rate his care? He was given a diagnosis and directed to proper management, but his case would be deemed unsuccessful, his experience unsatisfying, because we, as a system, didn't engage Jose to understand his simple concerns and work with his needs. As we've heard from so many of the other speakers today, we've begun to recognize that we need to engage patients to achieve better outcomes. We also recognize that our methods for collecting patient feedback, usually through surveys, limit our ability to understand the nuances of these patients' needs. Given we know all this, we wondered, how can we engage patients like Jose to design more personalized, more effective care? This is a question we set out to explore, and taking a cue from the technologies industry in design thinking, we decided to test a methodology known as experience-based co-design. Experience-based co-design is a participatory method that engages patients and all care team members in every step of the research, design, and implementation process. For our work with patients, we partnered with a primary care startup in Boston called Perfect Health. Perfect Health's first clinic is based out of a residential property in Hyde Park and serves a diverse community of Medicare and Medicaid patients. Prior to our work, Perfect Health had conducted a series of surveys and a town hall style meeting in order to elicit feedback on health needs of their community. The results of these surveys were brief, categorical, and focused mostly on physical health. They didn't reveal the personality of the community or how community members felt about their day-to-day well-being. The goal of our work was to go beyond these initial results to gain a better, more comprehensive understanding of health in Perfect Health's community, and to engage these community members to design more patient-centered care. For our implementation, we spoke extensively to 4 community members about their health experiences, daily challenges, goals, and fears. We also interviewed the CEO of Perfect Health and the residential housing manager in order to understand their vision for the community. Finally, we ran 2 group workshops with community members and included English, Spanish, and Haitian Creole speakers. These workshops were highly interactive, and we used videos, brainstorming sessions, and small group activities in order to facilitate and begin to guide a conversation about health and well-being.
We were surprised to find that the top themes from these assessments were not focused primarily on physical health. We asked the community members 2 questions. In response to our question, what does health mean to you? Community members responded by discussing their strategies for staying healthy. For example, some community members talked about the importance of religion and spirituality in their lives. They talked about how when they're feeling emotional or sad, they often turn to prayer as a way to recollect themselves and stay calm. Others talked about how it's important for them to stay busy. They stay healthy by being heavily active in the community and doing things like helping neighbors who are in need. We also asked, what challenges do you face in trying to achieve health? In response, community members talked about struggles such as those with emotional health, especially in relation to the death of loved ones. People talked about the frequency of deaths within their community and the amount of loss they felt when they realized neighbors had passed away. Many also talked about the struggles with social isolation. For example, many community members had family living outside of the United States, and not having family members close by to visit often led to feelings of loneliness. And lastly, there was much concern about safety, both within the housing unit and the surrounding community. In particular, community members were concerned about the lack of fire drills, and they were worried about how less healthy members of the community would be able to evacuate if there ever were to be an emergency. Additionally, beyond these insights into kind of nuanced understandings of patient values and experiences, experience-based co-design was useful as a community building tool. While gaining the trust of patients was a challenge throughout our project, we found that the interactive nature of the small group activities helped break down existing barriers and hierarchies. For example, some residents had not initially felt comfortable talking to us, but through the group exercises, they began to open up and share their individual stories. We had some community members who had lived in the same building for 10 years and never spoken to one another. And suddenly, during these discussions, they were offering each other health advice and support. Based on the top themes from our assessment, we came up with a series of recommendations for how we could empower the community and enhance community health. For example, in order to help the community process grief from the loss of loved ones, we recommended implementing behaviorist-led support groups. To assuage concerns about housing safety, we recommended organizing a community member advisory board that could work with the housing staff to lead initiatives such as implementing fire drills. And finally, we wanted to support the community's spiritual values. As such, we recommended implementing prayer groups within the housing community, as well as involving spiritual leaders in health activities. So, at the end of our project, what did we learn? We found that experience-based co-design allowed us to gain detailed insights into community health values. We also learned that it was beneficial in highlighting opportunities for collaboration amongst a diverse set of stakeholders. At the same time, however, the jury is still out on how we can translate these insights into actions. We know, for example, that Jose would have benefited from sharing the nuances of his story, but the current limitations of the health system often hinder our ability to take the next big step forward. What should we do in a system where reimbursement doesn't extend to activities such as leading a walking club, ensuring fire safety, or engaging in spiritual reflection? As a system, we need to make the transformation from feeling like we know all the answers to sitting down with patients and working out solutions together. Asking patients a few simple questions is the first critical step. Thank you.